Welcome to the Take Your Life Back Summit, your roadmap out of chronic pain, fatigue, and autoimmune disorders. And I'm your host, Dr. Heather Yost. You're going to get to meet dozens of experts that are going to help you feel hope, find answers, and ultimately start healing. You're going to get practical, workable information that you can put to use right away. So let's get started with today's special guest. I actually chose Dr. Josh Shields because he's not only a good friend of mine and colleague, but I've been able to see firsthand the impact that he's making in this world and the thousands of people's lives that he's changing. What I want to do is tell you a little bit more about him, and then we're going to dive in and get to meet him. Dr. Josh Shields is the clinic director and owner of Integrative Wellness Centers. He is a certified functional medicine practitioner and has traveled the country as a consultant and educator of functional medicine for other professionals. Dr. Shields is recognized as an industry leader for pioneering and developing natural programs geared towards helping people reverse chronic disease and helping healthy people who want to become healthier. Dr. Shields has also developed a niche of coaching high-level professionals to help them to be able to serve their employees, customers, and the demands of their high-stress jobs in a manner where they can thrive instead of just survive. Dr. Shields has been featured as an expert on several health and wellness topics for Fortune 500 companies like GE, Chic-Fil-A, and Comerica Bank. So thanks for being on here, Dr. Shields.
Thank you for having me. It's nice to see you again.
Yeah, it's good to see you too. What I wanted to start with, just because I think your story and your passion comes from, I know it comes from a personal place or an experience in your life. So I wondered if you could share that with our listeners. Like, why do you do what you do, and why are you so passionate about it?
Well, it's interesting. I was actually raised a little differently than most people. My mom and dad were both chiropractors. And so I grew up in a household where I remember when we drive by McDonald's, my mom would say, "That's where Satan works." So
Are you serious?
Absolutely. So I remember the first time I actually went to McDonald's when I was 16. I got my dad's pickup and I drove up to McDonald's and I got like 4 cheeseburgers and a Coke and never felt so sick in my life, but it was one of those moments where I finally got to enjoy McDonald's.
And you weren't grounded because of it?
I didn't tell them. You kidding me?
No.
She might be hearing about it for the first time today. So. But yeah, don't say anything. But because of that, I'd inherently had a natural tendency to who I was in my lifestyle. But it was, oh my goodness, there's quite a storm here, and I think there might be an alarm going off. So I don't know if you can hear that. If you can't let me know, it's going to get louder, I do think.
It's okay.
But obviously, being in that setting, it was in my DNA in some way, but I still fought it. And I wanted to go to school to be a nurse anesthetist. I thought that putting people to sleep for a living sounded like a pretty good idea because if they're sleeping, they can't really complain. And I thought that might be kind of fun. But and in my studies, to become a nurse anesthetist, I had to write a paper on natural health. And at the time, the rumors of ADHD were going around, and my stepmother at the time had thought that maybe my father had it and I had it. And so I had an interest in ADHD, and I started studying about it. And as I was studying for it, it was quite alarming that I found out that these children were taking a class 2 pharmaceutical drug, which is on the same level as cocaine or heroin. And they were taking it to help them with their symptoms of not focusing. And then I kept looking in the research and I started seeing that there were some natural things that could help these children as well. And by the end of my report, it was only supposed to be like 4 or 5 pages long. I ended up writing a 16-page long report because I was just I was just flabbergasted at the fact that this was the conventional treatment was using cocaine on some form of a level to help children pay attention. I just thought it just was ludicrous. So I called my mom and said, "Mom, I know this is something that is a surprise, but I'm going to go to school to be a chiropractor." And my mom said to me, "Well, Josh, you've always been a chiropractor. We're waiting for you to come to the same realization." And so after getting out of chiropractic school, I felt that the tools that we had learned were great. I felt like, using chiropractic was very helpful for a lot of people with a lot of conditions, but I really wasn't getting the results that I wanted to or thought were possible because in school, as you know, we were taught that there's a root cause to everything. And there's always going to be, hopefully, a natural solution for that problem, or at least try natural solutions first. And here I saw my patients taking depression medications. I saw them have to take birth control because their menstrual cycles were out of control. I saw them not sleeping at night. I saw them taking, cholesterol medications. And I knew that there were answers for these patients. I just didn't have the tools that we learned in school either. And so eventually because of my own health issues, which I don't know if we're going to get into much today, but because of my own suffering, and then I saw my patients continuing to suffer, I eventually found functional medicine. And once I found it, I never turned back. And here we are now, 7-8 years later, and now we have a practice. We have 2 other doctors working with me, and we're in Michigan. And my whole life is evolved, and we've helped so many people now come to the conclusion that they don't have to rely on prescription medications to be well.
Can you dive a little deeper into what functional medicine is?
Oh, goodness. I'll try to give you my shortest answer. To me, functional medicine is a whole systems approach where we look at the entire body and look at how all the systems are integrated to create health. And I think it's odd that we go to a doctor for our sinuses, then we go to a doctor for our gastrointestinal system, then we go to a doctor for our ear, nose, and throat. And we go to these different doctors, but if you really think about it, we're one integrated system where, in a sense, your liver is connected to your digestion is connected to your immune system, which is connected to your circulatory system, and everything's connected. And so functional medicine wants to look and understand how are these systems connected and where is this breaking down occurring, and help reestablish that normalcy in that system so the body can be whole and well again.
Right. I totally agree. It's like you were saying, this is connected to that and connected to that. And I think that we forget that these systems are so interconnected in the way they function. Yeah,
absolutely. It's amazing when a patient comes to our office, because when they come in, let's say I had a patient I can think of, or she came in strictly because she had digestive concerns. And after we started helping her with her digestive concerns, those issues were resolved, but then she started also noticing that her hormones were more regulated, her menstrual cycles were regulated, her acne went away. And so it's interesting that with our treatments, our side effects are more positive effects, where with medications, a lot of times it may help with the one symptom, but then it may lead to other symptoms that the medication causes. Then they're taking another medication for the symptoms of that medication. And so it becomes this endless cycle because it never really gets to that root cause.
Right. So you view health really as 5 pillars. Could you expand upon that and go into those 5 pillars for us?
Well, absolutely. Whenever we meet with a patient, I take that meeting as, I know this is going to sound dramatic, but as a do or die moment for that patient. A lot of times these people have been looking for answers for years. They finally come to our office and they're on the wrong path. And it's my job to help them understand that there is a better way. And I think of it as telling people the truth. And the truth is that there's going to be really 5 fundamentals to health. And the first fundamental of health is, we start with the mind. And you've heard the adage, you are what you think you are. And the mind, the war is won and lost in the mind. And so in our office, we really like to look at what are the stresses in that individual's life? What's going on? Are they a mother of 3 that has a full-time job and she's unhappily married? Well, guess what? That's going to cause some health issues. And it's our job to give that patient then some tools to learn how to adapt to that stress. And the research that's coming out now is saying to us that, depression and anxiety aren't as genetically linked as we would like to think they are. And because what we've seen is that with some certain habits that we can inject into somebody's lifestyle, when they start doing these habits, they're going to become happier and they're going to be less stressed and they're going to sleep better and they're going to have more energy, because a good behavior is a good behavior. And so, we help patients understand, for example, we have them gratitude journal, where that's so important for them to every night, just take that moment and say, hey, what am I thankful for today? And then they write out the 3 things that they're thankful for. And every day it has to be something different. It can't be the same 3. And what happens is that starts to developing an idea where you look at your life and you look for the positive things that are happening instead of the negative things. And then that starts to build momentum for some of our patients. We have other things that we give and other exercises, but it's just been amazing when you start with that one first fundamental. And the second thing we like to look at with our patients is the health of their gut. Hippocrates once said that all disease starts in the gut. I don't know if I necessarily agree that all disease, but I can tell you a lot of disease starts in the gut, and a lot of people are missing this major component of health. And in the gut, what we like to look for is we like to look for nutritional deficiencies. So we do comprehensive lab testing that looks at over 12 nutritional deficiencies that could be occurring because you can be malabsorbing food and not realize it. So that's one of the things that we can do. Another thing we like to look at when we look at the digestive system is we like to look for autoimmune diseases. So we test out of the gate 7 autoimmune diseases that are the most common. And you'd be surprised how many times we're the first practitioner to diagnose them with an autoimmune disease. The third thing that we like to look at when we look at the gut is we like to look at a yeast called Candida. And we see that on about 60% of our patients have an overgrowth of this yeast that is, in a sense, an infection in their body. I try to explain it like if people are familiar with athlete's foot. Imagine athlete's foot inside of your body. And what's happening is you have this yeast that's eating the foods in the back, eating the foods that you're supposed to be eating. And then those little bugs have been shown that they can signal your brain to have strong cravings. So people have strong food cravings. They have bloating and gas because of that one substance, candida, that we find so often that people don't even know they've had it. The third thing that we like to look at with our patients is the function of their liver and how well the body's detoxifying. And what we find all the time, Heather, and one of the biggest mistakes I see is that people aren't getting their inflammation levels tested. And this is something that anybody can do when they walk into their doctor's office tomorrow. They can walk in and say, you know what, I would like my C-reactive protein checked. Right. I would like my homocysteine checked. These are two markers that indicate to us if the body is able to keep up with toxicity, and if those toxins are, and the body's not keeping up with those toxicity, if it can lead to damage to the cells. When those cells are damaged, they're going, just imagine if you somebody to punch me in my face, my eye's going to swell. Well, toxins basically damage the cells and cause them to swell. So you can measure that swelling. And research has told us now with that swelling occurring, Heather, that it can lead to cancer, it can lead to heart disease, it can lead to strokes, it can lead to Alzheimer's, dementia, you name it. Every disease, not every disease, once again, we don't always want to say every disease, but the majority of diseases have an inflammation component to it. So it's so important to start with inflammation, to look at inflammation.
One thing that you've told me too a long time ago, I mean, by getting the homocysteine and the C-reactive protein checked, again, which you can do with any practitioner, you see C-reactive protein levels double what they're supposed to be all the time in young people. And statistically, if they're double, they have a certain percentage higher chance of a heart attack or stroke, correct?
Absolutely, absolutely.
Statistically.
Yeah, I believe it's 3 times higher risk of a heart attack or stroke if the C-reactive protein's higher. But some of the research, Heather, coming out now is that homocysteine is even a more predictive indicator of having a heart attack. 75% of the people that have a heart attack, now listen to this, 75% that have a heart attack have normal cholesterol.
Right, right.
So that's the first thing that we've always been taught is, well, if your cholesterol is high, you're at risk. But if you think about it now, if your cholesterol is high, you're actually at a lower risk. Because 75% of the people that are having heart attacks have normal cholesterol. So that means only 25% have high cholesterol. Right. Now, conversely, you take that data and information now and you flip it, and they find that homocysteine being elevated is present in 75% of the patients that have a heart attack. So homocysteine is a more predictive analysis, but the reason you don't hear about it a lot on TV or in commercials is because there's no drug to treat it, which is such a travesty.
Right.
Okay, so I guess going into the fourth topic now, the fourth thing that we look at with our patients is their hormones. And I think a big mistake a lot of patients make is the first place they like to think is that it is their hormones. And it's easy to understand that because it's obvious that when you're having menstrual problems, it's a hormone problem. It's obvious if you have a thyroid problem, you think it's a thyroid problem. But what I'm finding is that hormones are downstream. And that's actually why we talk about it in the fourth position, because I've actually seen it where, and it's funny because as a practitioner, we start to learn from our patients. But I remember I had a patient come in once and she goes, you know, I used to have terrible hot flashes and somebody recommended yoga to me. And when she said that, I kind of looked at her, and I know this sounds crazy coming from somebody that comes from a natural background, but I looked at her like she was a quack. I'm like, you really think that doing yoga is going to help with your hot flashes? And it did. She said when she did it, the hot flashes went away. And then she said when she stopped doing it, they came back. And when she started doing it, they went away. But after I really started to think about it, I could totally see the correlation, because when you're stressed, it's going to release a hormone called cortisol. Well, when you have high levels of cortisol, it's going to lower your levels of progesterone. And so now you're starting to see how all these different connections are being made in the body, that your mind and the power of your brain absolutely is going to affect all of your other hormones, especially since cortisol is such a powerful hormone. So we do look at hormones in our patients, but we kind of look at them as a byproduct of the overall health of the patient. And so some of the most common hormone tests that a lot of people aren't getting tested is insulin. A lot of times we'll see where the blood sugar is normal and their A1C is normal, which is the accumulation of blood sugar over a 3-month period. But then we'll look at insulin, and insulin's through the roof, which is an earlier detector that somebody's becoming insulin resistant. And with insulin resistance, we know that insulin causes a deficiency in progesterone, an excess amount of estrogen, and an excess amount of testosterone in women. So now we've created a hormonal problem that would normally be treated with birth control, but could be easily resolved if we get insulin down and normalized.
Right. Right. Corrected.
Yeah. And the fourth thing we like to look at the fifth thing and the final thing we look at with our patients is their physical well-being. I can't tell you how often and how much so many people's problems are caused because they're really not addressing the physical well-being. They keep forgetting that when you exercise, it doesn't just help you physically, it also is going to help you mentally. Research has shown us now that when we exercise, that we're more able to deal with stress. Well, if you're able to deal with stress, then that means that you're going to have a better response to it. That means you're going to have less cortisol. We know that when you exercise, it's going to help your digestive system. We know that it's going to help your immune system. We know it's going to help your detoxification system. We know it's going to help balance your hormones. So we can't ignore how important all these factors are. And the biggest mistake I see is that people are so programmed that we go to doctors, we get a diagnosis, and then we leave that doctor's office and we're given one prescription medication.
Right.
They then kind of take that same ideology to practitioners like you and myself, where they come and they go, okay, well, Dr. Heather is going to give me a natural diagnosis, and then she's going to give me 1 or 2 natural supplements, and then my life's going to dramatically change and improve. And that's just not the truth. If somebody's seeking help and looking for help, they have to find a practitioner that's going to involve all 5 components of health, because that's the truth. If we're in any way ignoring those aspects of health, then the chances of full recovery and optimal health in life are very, very low if you don't address all of these. And so with our office, we have a process in place that's going to address all these issues with our patients. And I believe that's why we're getting such great outcomes and why our office is absolutely exploding.
Right. I know it is. That's awesome. You're helping and saving so many people.
Well, time out. You said something incorrect there. I'd like to stop.
Okay.
It's not us that's doing it.
Right.
It really is the patients. And when we empower our patients and we educate them on what their responsibilities, what their roles are in this health process are, then their lives change. But as long as it continues to be a paradigm where they come to me to be fed, then they're going to always be reliant on me to feed them. But if I can teach somebody what the skills are that's necessary to have a good life, and then I want to be their guide for the rest of their life. I want to be able to hold their hands. I want to be able to walk them through a process and an engagement where they can evolve and change. And as they go through those changes, we're there to help support them through those changes. Because as you know, life is very dynamic. It's not static. And so they need an approach that's going to help them through their life as they age and change.
I like how you tell people too, it's not an event, it's a process. And you might not be perfect at the end of the first phase of care, but you'll be well on your way.
Yeah, that's thank you. I did forget to mention that. It is such a process, and I think that's what we all keep looking for. Is honestly, even myself, we all love it when it's in a single event that changes their life, but that's really that's not the truth.
No, not at all. You talk about cases being either correctable or manageable. Could you elaborate on that?
I'm not sure where I need to go with this, but obviously
you've mentioned that there's good news and there's bad news. Some people are correctable and some are manageable. And part of that, I think, is how long are you waiting, to get help?
Well, there's a couple different scenarios. Obviously, in some cases, people have had their bodily organs removed. And if you understand the definition of health where it says 100, you have to be 100% whole. Once somebody's had organs removed from their body, they're not going to function at 100%. So in that case, we can just do the best we can with what we have. The other part of managing and patches, in some cases, people have let the damage go so long that they do have irreversible organ damage. And I know a lot of people come to me in hopes that we're going to help them get off for example, their thyroid medication. But many times the thyroid's not necessarily a self-regenerating organ that I know of as right now. I just did read some research this morning that they're finding that people are able to start reversing type 1 diabetes, which is fascinating that they're seeing the beta cells being restored and brought back into function again, but I haven't seen it yet with the thyroid. And so in some cases, when somebody comes to us with a thyroid disease, I tell them that we're not going to be able to get them off their thyroid medications necessarily, but we want to alleviate a lot of the symptoms that they have from having that thyroid condition. One of the main causes, as you know, Heather, of thyroid disease is an autoimmune disease. And there is no cure with an autoimmune disease when we have a patient, but there's better ways to manage that autoimmune disease. And that's where the real travesty is really occurring, because what we're seeing in our office is, so upwards of 80 to 90% of the patients that have a diagnosed thyroid problem have an autoimmune disease, and they don't even know it. And the problem with this is that if you don't know you have an autoimmune disease and you don't know that there's a simple way to live your life that can help you start to reverse some of the damages, I mean, not reverse the damages, but prevent some of the occurring damages from getting worse and accelerating over time, then it can be a terrible, terrible long road for a lot of these patients. And what we're finding in our office is when we're able to help a patient address that they have an autoimmune disease, we're able to see that their antibodies are able to come down, which means their immune systems are attacking the thyroid less. So now they're not going to be taking as much thyroid medication down the road, hopefully, and that we're going to help them avoid a lot more disease and illness. So that's what we talk about patchable. And now the correctable cases when we don't see an autoimmune disease, where we just see inflammation or we just see some imbalances that can be corrected if we catch it early enough.
Right, exactly. And you mentioned that blood work can sometimes get kind of tricky. I know that you've used the analogy of a house on fire in the mailbox. Can you tell us that analogy?
Oh gosh. Well, Heather, we do over 80 tests on our patients, and it can be quite colorful when you go over a test with a patient, and it's quite easy for them to kind of get distracted when we're looking at over all the test findings. They're kind of looking at they're like, look at an individual marker. What's that marker? What's that marker? What's that marker? And what I'm finding is it can get so complicated that patients then start to forget what the main purpose for them being there is. And so I really tried to help patients understand that there are sometimes maybe 1, 2, or maybe at the most 3 things we really need to identify as the major problem. So for example, if somebody has high inflammation levels, to talk about a slight magnesium deficiency doesn't really make sense. Even though it's something as a practitioner I need to take note of, but to discuss that with the patient when the house is on fire, it's like talking about what the condition of the mailbox is in.
Right.
The mailbox, yes, we need to talk about it. Yes, it's broken, but you've got to put the fire out. You have to address the things that are most important. And so our office, we try to help our patients understand what are the highest priorities of things that we get corrected now. And a big part of helping people get well is knowing how to unwrap the package properly so that you can get to the prize inside. If you do it in the wrong method, sometimes you'll never reach your final goal, your optimal goal, optimal health.
Right. I'm glad you mentioned that, because I was going to say, I know you educate people. There's a specific program of care that needs to be done in a specific order. And I think a lot of people maybe self-diagnose or go on the internet, maybe get a detoxification program, buy a boatload of supplements from Costco or a grocery store. I think it's important that we all understand that we can't always do this on our own, that we need a coach, because it's not as simple as just taking supplements, or it's not as simple as just doing a fast or a detox.
Well, Heather, if it were that simple, I wouldn't be sitting here today, because I once was Dr. Google. I remember when now I guess we can get into my story. Is what happened is when I started to lose my sleep and started developing insomnia when I was in practice, I turned to the web, and that's when the web was first kind of started coming out, and you could get pretty much anything and everything you wanted to see. And I remember learning about adrenal fatigue, and I was convinced I had adrenal fatigue because I had all the symptoms and I had all the problems. And so I self-diagnosed myself without any testing that I had this condition. And I treated myself for about 2 years on my own with 0 results. I mean, maybe an improvement here or there, but nothing really long-term sustainable. And then I met a functional medicine practitioner. He recommended some testing to me, and the testing, quite honestly, was quite expensive. And so I kind of shot him down at first. I was like, I'm not spending $800 to try to figure this all out. I'll just keep going on my own. And so after about 6 or 8 months longer, I finally called him back. I was like, all right, what testing do you want me to do again? And so I did the testing. And after I got the results back, we were able to discover what my issues were that were specific to me. And that's where I think a lot of mistakes are made is, yes, you can do some general changes. And yes, you should. I mean, eliminate dairy, eliminate gluten, eliminate sugar, do those fundamentals first to see how much you can improve. But if beyond that you're not getting the results, then you do need to seek out professional help, that somebody has done it over and over again. I think it's odd that we take our cars into the shops to get repaired. But if you had an electrical problem in your car, you would never go to AutoZone and say, hey, can you sell me some wires and some circuit boards so I can go try to repair my car? But yet that's what we're doing with our bodies, because it's just the information's there. But you have to think about it, Heather, just like you and I, we help thousands of people. So we've been through this. You're going to get better results when you have a practice with a proven process and information on how to help you. And it's not just shotgunning it and guessing. And that's a big mistake a lot of people make. Even practitioners are still making. You come in and you're tired. Well, here, take this supplement. try this supplement and try this supplement. So it becomes the try game. And I remember I had a young lady that came to my office and she was desperately in need. She was 32 years of age. She was extremely fatigued. And I said, well, let's do some testing. She goes, well, I really can't afford the testing. I said, well, you know what? I'm not going to be able to take care of you without testing because I do not operate without testing. So she said, okay, well, I'll get the testing. We got the test results back. And actually the lab called me that weekend and told me to call her and rush her to the hospital. It turned out she had such a low hematocrit level. Her hemoglobin hematocrit levels were so low that she could have had ischemia of her heart and she could have had a heart attack. So imagine if we'd treated her blindly, not knowing what her specific issues were, it could have been devastating.
Could have been disastrous.
Yeah.
Yeah. I think that what we need to realize too is that we want quality and quantity of life. And the earlier you start investing your time, energy, and money on that, the better. If you have a symptom of any sort, your body's warning you. You've got to dig a little bit deeper and get to the root cause of what's actually going on.
I'm so glad you brought that up today. I was thinking about that actually this morning when I was working at the gym. I was listening to a gentleman speak, and it kind of brought my mind to a point of, it's so weird that we've been so programmed that wellness is a colonoscopy and a wellness is a mammogram, and wellness is getting a prostate exam. Getting these exams, to really what they're doing is it's early detection. And we've been focused on so much that it's symptom care. If you have this illness, take this pill. If you have this illness, take this pill. Make sure you don't have cancer, so get this checkup. But all these things is early detection system so that we can catch the disease before it's killed you. So now we can use very, very expensive treatments and profit from them. Not saying that's the intentions, but it's not. We have to be more proactive. And it's so hard for people to understand that you can get an evaluation to see where your body's at, where the balance is at before it's broken. And then once you are well, a lot of our patients make the same mistake though. They get to our office, they get to a point where their symptoms are gone, they feel better, and they're like, thanks doc, I'll call you when I'm broken again. And that's just a bad idea, especially when 1 out of every 3 Americans, I saw that again, 1 out of every 3 Americans is developing cancer. 1 out of every 3 is developing heart disease. And the first symptom of heart disease is a heart attack. Do not wait for a symptom to start working to be better and healthier. And that's some of the best advice that I can give somebody is be more reactive be more proactive than reactive.
Right. And I think you bring up a valid point that makes me think of autoimmune disorders, for example. Some of them can sort of fester subclinically or no symptoms for 10 to 15 years. So doing a comprehensive blood panel, similar to what you do in your office, looking at 80 different markers, but insulin, homocysteine, CRP is going to help you. You're going to have a bit of a window into your future, and really everybody should be doing this regardless of symptoms.
Yeah, one of our favorite tests, Heather, is that you've used and I've used too of myself is the cyrix test. I think it's array 6 or array 15, where they test for 21 different autoimmune diseases. Right. And it's a fantastic test to see, because we're finding now with the research is that these antibodies are predictive in nature. So we don't necessarily have the autoimmune disease yet, but if we see that we have antibodies to them, that we know then within, like you said, 7, 10, 15 years, 80 to 90% likelihood you'll develop those autoimmune diseases. So if we can catch it early enough and get on a autoimmune lifestyle before it's too late, then that just makes all the sense in the world to me. And
prevent those antibodies from starting to attack.
Yeah, you want to measure those and keep an eye on those. Fortunately, I passed the test. I aced it. And so I won't do it every year, but patients that we do see positive, you want to keep an eye on those antibodies for the rest of your life. That needs to be your new marker, not just looking at cholesterol. I mean, it's so silly to me. We just get our blood pressure and cholesterol checked, and that's our wellness care. That's absurd. And that's what's great. We are seeing a revolution. We are seeing a change in the paradigm. I mean, people know that the pill for an ill mentality, that method of treatment is out. It just doesn't make sense. It's not the truth. And I just don't think people are stupid enough to buy into it anymore.
I agree. As consumers, we're looking for something else. We're looking for better answers. And I think it starts with being your own best advocate, asking the right questions, not going to, each practitioner is trained in a certain way. So not being mad or upset that your medical doctor maybe didn't request these tests or understand how to interpret them the same way. It's knowing, each profession does what they do and they do it really well. So
Yeah, that's exactly right. I think that what we say is, you only do what you do, and
Right.
you only do what you're trained in. And I think, if somebody have come to me or you and said, "Hey, I think I'm having an appendicitis. Can you help me?" They've called the wrong doctor's office. That's just not what we do. And so we do see that a lot in our office where people come in, they're actually angry at their practitioners. And their doctors just don't know what we know. I have two of my best friends here in Michigan it's a couple, and one's a neurosurgeon and his wife is a cardiovascular surgeon. And I promise you, these are the two of the brightest people I've ever met in my life. But when we start talking about the three phases of detoxification, they look like a deer in a headlight. They don't get it either. And it's not because they're not smart. We don't know everything. And I think we always like to think that our white lab coats and our doctors know everything, but the truth is we don't, guys, and we only know what we know, and we only know what we've been trained. So please don't get angry with me if I don't know something. And I think the biggest mistake, though, is when we ask a doctor and they come across with an arrogance of, we're always down on what we're not up on. And I want to say that again, we're always down on what we're not up on. And so instead of being defensive, that doctor should say, I'm not quite sure what that is, but it's something I should look into because I'm not familiar with it, instead of just shooting it down.
Amen. Amen. I'm glad that you said that. I understand that you have a special gift for our listeners. Could you explain that?
Yeah. In our office, we have the 5 pillars of health mapped out in our workbook that we give to our patients. And so I'm offering everybody today listening, if they'd like to see this gift for themselves and read what we're giving our patients, some of the educational tools that we're giving them, our patients, to share this with your group, I think would be a great gift for them. And so they can have that as well as our cookbook that we offer our patients. It's over 260 pages. It's a color cookbook. It's a wonderful, wonderful piece. And these items are free. And I think you have a link somewhere on your website or somewhere with they'll get it, but it's IW Centers or www.iwcenters, plural, .com/free gift. .com/free gift.
Okay. Thank you. That is awesome. Everybody needs to take advantage of that. Before we go, though, can I ask you a couple of fun questions?
Oh, boy. Okay, yes. I'm not very good at these. I'm not that witty sometimes, so I'll try my best.
Well, I just want to know, if we came into your kitchen, opened up your refrigerator, what would be 2 things that we would find every single time?
Well, you want the good foods or the bad foods?
Hopefully the good ones. Whatever would be every single time.
I'm still trying to get my lifestyle to where it's 100% perfect. And so I do want to start with that, is that, guys, don't beat yourselves up. It's just about improving. It's about progress. Wellness is not a destination. It is a lifelong process. And I haven't gotten there yet. I'm still trying to get there. I'm not 100% compliant or perfect in my lifestyle. But in my refrigerator, the good things that you will find, for example, are you'll always find hummus, always ready to go. We have a quick thing of hummus, and then we always have cut up peppers and cucumbers ready to go as well. I do have to admit, though, too, you'll also find Heineken in the back top right corner. I have 2 beers in it right now. But yeah, I do enjoy a Heineken occasionally.
Good to know. I think that's also, before we go on the next question, I love that you really offer a non-judgmental approach to taking care of people. I know you ask them to fill out a journal, but you're not doing it to kind of smack people down. You're doing it to build them up and let them know that the past is just the past, and you're here in the present, and we're going to look to the future. So
yeah, it's funny too, because we do see people that just make mistakes, and they just aren't aware of something. And so we don't know what they're eating until we eat it. And then we talk to them and they're like, oh, I had no idea that had that in that, and that's bad for me. And so we let them know, but it's not to make them feel bad. It's just to help them figure out, just to learn a lesson learned, hopefully.
Right. I agree. And if they're frustrated, they can pop over to your house and have a beer with you. Okay. Secondly, if you were stranded on a desert island, what 2 products or supplements would you take with you?
Oh boy, products or supplements. Okay. So beyond just bringing food, I have to bring a supplement or product. I'm going to go old school, Heather, on this one. I love vitamin C. I take about 4,000 units a day, and it's just something that I take on a daily basis. And then my second favorite product all time is probably a product called Glutaclear from Metagenics. It's a product that helps improve your glutathione levels and helps your body detoxify. And for me, that's really one of my biggest issues. I'm a poor eliminator of toxins, and I've seen that genetically now, and I've also seen on my testing, and that product seems to help keep me from going south too quickly. Awesome.
Well, lastly, if people want to learn more about you, What's the best way to do that?
Well, yeah, just go to our website, www.iwcenters.com. I don't know how many W's I just said there, but check us out on our website. We don't encourage distance care. I'd prefer you find a practitioner close to your home, somebody that lives nearby you, because I love that relationship. But we do help patients out of state sometimes, especially if they're referred to our office. But I'd be glad to schedule a consultation. One of my other doctors, we do have phone consultations with patients as well. So
good, awesome.
But it's definitely not our niche, but it's something that we will accommodate for your listeners.
Okay. Thank you so much. Thank you for joining us. As always, I enjoy speaking to you, and I know the audience has gleaned a lot of pearls from our conversation. So I appreciate your time.
No problem. Thanks a lot, Heather. Have a great day.
Thank you. Well, that's our segment for today. Thank you to our listeners. Be sure to watch for more from us, Dr. Heather Yost and Yost Wellness Centers. That's it. Have a great rest of the day. This is the Take Your Life Back Summit. Take care. Be well. We'll see you tomorrow.